I'm Dr. Zachary Watts. I practice in the Systems Healthcare office in Chapel Hill, North Carolina. Um, I'm trained in a lot of like biochemistry, biomechanics, and applied kinesiology. That's the main technique I use in my office. So it's very like functional medicine, family wellness style practice. So today we're talking about the flu season, natural medicine cabinet essentials, and kind of how to keep your immune system strong and healthy. So, why is it around this time we're all getting sick? Um, Overall, in general, basically, we kind of stop focusing on our health as much, or the things we're doing that aren't great for our health or immune system finally start to catch up with us near the end. So we're eating more sweets. We all enjoy, pumpkin rolls and Christmas cookies and all of that. We're eating lower quality foods as we're traveling, and we kind of have to compromise on that a little bit. We're getting less sun as a society in general. Just throughout the year, most people don't go outside as often. And then as it gets colder, of course, we go outside even less often, and we're getting less UVB rays from the sun to make vitamin D. So all of that plays a big role in our immune system and health in general. Of course, we're traveling way more during the holidays, so we're stressed out. We're stressed out about going and seeing the in-laws or going and seeing other family and all the plans and stress that come along with the holidays. And then less sleep. We want to stay up, hang out with our friends, family, and lots of long days of traveling and driving. And yeah. So first I want to kind of go over your immune system in general. Of course, like there's so much going on in the immune system. There could be several hours of talking just to cover everything that the immune system does. But general overview as far as looking at the flu and looking at what we need to talk about today is you've got your innate immune system and your adaptive immune system. So the innate immune system is like your first line of defense. It's like the walls around your house, the walls around your castle, so to speak. So it's like your skin, it's your stomach acid, it's very general, very fast immunity. It's security guards that are walking around. It's killing things as they show up. So the skin's going to create a protective barrier. If you get a cut in the skin, it makes it a lot easier for a pathogen to get in there and for that to get infected. Stomach acid, that's going to be cleaning the food that we eat. None of our food is sterile. Our stomach acid does a very good job, having a pH of 1.5 to 3.5, I believe. So that's going to kill off most germs that are on your food. Your mucous membranes, so of course your sinuses, but also inside your mouth, your eyes, your intestines, all of those help to capture pathogens, capture allergens, dust, anything that you're coming in contact with to try to stop it before it gets into your bloodstream and into your body. And then the natural killer cells, those are like, a security guard that's walking around monitoring the body and trying to stop things from getting in before they cause more damage. Once something gets past the innate immune system, then we move into the adaptive immune system. That's where our body is fighting off these different pathogens. And it's a little bit slower, but it's much more specific to what it is that you're fighting off at that time. So you're going to learn from the past experiences. If you get infected with one strain of the flu, the next time you see it, your body's going to deal with that before you even feel it. So you won't even know when you're exposed to that strain of the flu again most of the time. There are two different, you've got the T cells and your B cells within your adaptive immune system. Your T cells are what's going to be actually fighting off those foreign invaders, whether that's an allergen or an infection. And then the B cells are what's creating the memory cells as well as creating antibodies. Those antibodies are helping to neutralize the invaders. They're the ones that are very specific. They figure out the weakness of the virus or the bacteria or the fungus, whatever it is, to help neutralize it and help your body fight that more effectively. So let's focus more in on those T cells because that's what is actually taking care of the flu for you. So we're going to talk about Th1, Th2, and Treg. So that's your T helper cell. There is also Th9 and Th17. Those are more involved in autoimmune conditions, so I'm not going to talk about that. That just gets too in the weeds. So Th1 is fighting off infections, viruses, bacteria, fungus, and some parasites. Your Th2 are going to be dealing with more allergic responses. So, in North Carolina, when it's pollen season, everything's covered in yellow. That's your Th2 cells are responding to all of that. Heavy response to heavy metals, they get increased when you're taking a medication that you might be allergic to, or bad fats, substances and vaccines, etc. And then these are increased as well in most parasite infections. Stress also increases your Th2, so this leads our society to be more Th2 dominant. Most people tend to have a little bit more Th2 than they should, so you tend to have those more allergic responses. That's why people are having a lot more chronic allergies that aren't quite going away. If Th2 is left high for too long, that can lead into more autoimmune conditions as well. So it's all kind of a balancing game. If you've got an infection, your Th1 cells increase to deal with that infection, and then that's where your T regulatory cells come in to help calm down and balance those two out again. Like I was saying, most people end up being Th2 dominant. Our lives are stressful most of the time. We're exposed to a lot of different allergens and chemicals and substances that we shouldn't be exposed to constantly, but we are. So that leads to us being more Th2 dominant. So we have more Th2, less Th1, and that leads to people having more allergies and not being able to respond as well to infections. So we're kind of trying to focus, when I'm thinking through the immune system, I'm kind of trying to focus on creating a balance there. So that way, if you do get exposed to a pathogen, a virus, bacteria, whatever it might be, then you can bounce back from it very quickly. So your cytokines are then, we've all kind of probably heard about a cytokine storm at this point. If not, I'll talk through it quickly. But cytokines in general, they're messengers for your cells. They're messengers for the body to tell the body, hey, there's an infection here. There's an invader in this area. Go and deal with it. Take care of it. It signals inflammation. Some cytokines signal anti-inflammation, but most of them cause some form of inflammation because you need some amount of inflammation to deal with. If you have a cut on the skin, if you have a bacteria, it causes the fevers, it causes the brain fog and the fatigue, and that's all well and good when it's under control. The problem comes when your immune system's already imbalanced, so then you're producing way too many cytokines. Your body's almost overreacting to the infection or to the allergen, or you're not able to break down the cytokines because you don't have the supplement, or the nutrient that you need to break down those cytokines. So that's when people get the long COVID symptoms, or you get this cough that just won't go away. You get a sinus drainage issue that's not going away after you've had a virus or a cold or flu for however amount of time. We'll get into what to do for that in a second. So trying to keep the immune system healthy, trying to keep the immune system strong. This is a good overview of lifestyle-wise what you can do. Eating whole foods, exercising regularly, sleeping, getting the sun you need, stress management, nasal breathing. Let's get into that a little more detailed. I think most people have seen Super Size Me. It's no secret that the foods in McDonald's and fast food, they're not the best quality. They're very ultra-processed foods. They are very low in nutrients, in the amount of nutrients that they have. The more you process a food, the less nutrients that food is going to have. As soon as you harvest a food, it's starting to break down, it's starting to lose nutrients. So the more processes that it has to go through, the lower quality it's going to be, just even from a nutrient content standpoint. Then looking at stuff like what type of oils are in your food. Soybean oil, canola oil, corn, sunflower, safflower oils, all of the seed oils you hear everyone talking about, they are inflammatory, and they're omega-6 oils as well. So that's part of the issue. Like, even if it is a good quality, most of the time we get way too many omega-6s. So you just want to avoid them. Most foods you get them in they're gonna be rancid anyway. So they're causing a lot of inflammation in the body. I'll recommend going for grass-fed butter, go for coconut oil, avocado oil, beef tallow, fats like that aren't going to break down as quickly when you're cooking with them. Olive oil, when you're doing lower temperatures, is better. And then you should be eating grass-fed beef, high quality meats, proteins. That's where you're going to get the majority of your protein. You really don't get as much protein from eating plants. Your body's much better at breaking down and absorbing the protein from foods that are from an animal or were an animal, basically. So talking about omega-6s, let's get into omega-3s. Eating fatty fish, that's going to be your best source for omega-3s. Those are very anti-inflammatory. So that's helping to take stress off the body. That's helping to take inflammation away. You want a good balance. It's depending on the source you're looking at, you want like 4-to-1 omega-6 to or 4-to-1 omega-3 to omega-6 fatty acids. Standard American diet, most people get, I think it's 16-to-1 if they're lucky, omega-6 to omega-1 to omega-3s. So we're getting way more omega-6s. Reduce the excessive sugar intake. If you're getting way too much sugar, now your body's got to deal with what to do with that. It's going through your bloodstream. It's causing damage throughout the body. Insulin can cause a lot of issues if it's getting too high. So look out for the high fructose corn syrup. Try to avoid it basically boils down to still avoiding those ultra processed foods. Those are the ones that have way too much sugar in them. But you can also go too far with this. Don't go zero sugar forever, because that's going to add more stress to your body as well, where you have your liver then has to try to create more blood sugar by using the protein that you're either eating or taking protein from different areas in your body to keep your blood sugar at a stable level. So that's where people end up, if they're on keto or like a hardcore carnivore diet with no sugar for a long time, you'll start waking up with like night sweats, or you'll have other symptoms pop up. And then, I mean, a good tip for just improving your food quality is make as much as you can at home. Instead of going and getting a McDonald's burger, make your burger at home. You're going to know what nutrients. You're probably going to buy something that's a better quality, and you're just going to be feeling better because you're not eating McDonald's all the time. Okay, exercise. How does this help with the immune system? It helps with basically every single disease that we know of. So aside from conditions that your muscles aren't able to heal on their own, it's going to help with basically every disease known to man. It's the closest thing we have to a cure-all. Not saying it's going to cure everything, but it helps with the outcomes of almost every condition that we know of. It has it's a good anti-inflammatory effect. It's going to delay any age-related dysfunction that you have, so your balance is going to get better. Your bones are going to be stronger. You're going to be able to bounce back from injuries better because your body's better supported by the muscle strength. It also will reduce your chronic illnesses, so diabetes, heart disease, even things like dementia, Alzheimer's, like it's going to help with all of that. And then as you're exercising, your blood flow's improved, your lymph flow's improved. So your lymph acts almost like, to simplify it, it acts like your body's sewage system. You don't want your sewer to be stagnant for very long, right? That's going to cause a lot of issues. That's where your body's getting rid of the viruses, the fungus, the bacteria, the dead cells. So keep in mind as well, if you're doing a lot of high intensity exercise all of the time, this can over time, this can weaken your immune system if you don't give yourself time to properly recover from it. So after about a high intensity exercise, your immune system is weaker temporarily, but once you recover from that, then your immune system becomes stronger. Speaking of recovery, sleep is incredibly important for cleaning out all the toxins in your body. That's when your body does a lot of the cleaning. That's when your lymph is able to flow easier without you needing to move. And that's where your body cleans out the brain at the most. Antibodies are made much more efficiently in your sleep. Your Th1 cells improve during your sleep. That's when your body makes the most antibodies. That's when a lot of your Th1 system is working better because cortisol is low. So cortisol will inhibit your Th1 cells and it's going to increase your Th2 cells. So if you're chronically stressed, you may not respond to an infection that's around, but you're going to have a lot more allergies or possibly autoimmune type conditions. So when you get sick, sleeping it off is actually a pretty good strategy. Then once you wake up, go out, get some sun. That's going to help set your circadian rhythm so your body knows when to wake you up, when to help you go back to sleep. When you wake up, that's when your cortisol should be the highest. Throughout the day, it's going to come down and your melatonin is going to start coming back up to get you ready to fall back asleep. Going out, getting some sun is one of the best ways to help set your circadian rhythm to help you wake up at the proper time. Of course, there's the benefit that you're getting vitamin D, which improves the immune system, almost everything in the immune system. We'll get into that in a second as well. So in November, here, at least in North Carolina, that's when we stop getting the UVB rays that help us make vitamin D. That doesn't mean not to go outside, not to get some sun and enjoy the time outside, because that's also relaxing. But easy tip for you to know if you're getting vitamin D from the sun is if your shadow is longer than you are tall, then you're not getting enough of those UVB rays to get the vitamin D that you need from the sun. So ideally during those sunnier months, that's when you want to be out in the sun as much as you can, soaking up as much vitamin D as you can. That way you're ready for the winter. You have enough of it stored up. Speaking of stress, stress is going to decrease your body's ability to fight off infections by inhibiting those Th1 cells. So that's going to slow down, that's going to weaken your response to an infection, to a cold, to a virus. Also, like I was just saying, if you're chronically high in cortisol, your Th2 cells are going to increase. So you're going to be getting allergies, autoimmune conditions. These are the people that are like stressed out all of the time. They never get sick. They can't remember the last time they've been sick, but they've still got all these allergies or headaches, or they have some symptoms that are going on. I don't look at someone who never gets sick as someone who has a healthy immune system unless they have zero other symptoms and other signs, because that means your stress is so high, or your Th2 cells are so high that your body can't even mount an immune response to the infection that's there. So it's very common that as you start improving your immune system, you take the time to slow down and let yourself relax. That's when you end up getting sick. That's when you end up getting a cold. It was very common when I was going through school. After a big exam or after finals, that's when most people were getting sick, because everyone's so stressed out. They're not responding to the flu or the virus, whatever that's going around the school, until after they calm down from that big exam. So find a healthy way to help you relax. Here's a nice little chart off to the side. Just a little thought process to go through to never worry again. Breathing through your nose is incredibly important. Dr. Buteyko, a world-renowned breathing expert, says that you should breathe through your mouth as often as you eat through your nose. So if you're not eating or talking, breathe through the nose. That's going to help filter the air. So any dust particles, pathogens floating around in the air, that's going to be filtered through the mucus in your nose, like we talked about, through the hairs in your nose, to stop it before it gets into your lungs and gets deeper into the body, and then the rest of your body has to deal with it. Nasal breathing also will improve your nitric oxide levels. This is important because it has so many immune effects. It's antimicrobial, it is anti-inflammatory, and even anti-tumor. So, and it also has a very calming effect in your body. So, nasal breathe to calm down. All right. What everyone's here for, what supplements do you need to get healthy? We'll start with vitamin A. These are kind of the four most common that we use, especially for things like a cold, a flu, but immune system in general, we use all of this stuff a lot in the office. Of course, there's other supplements, other nutrients to look at, but that's part of why you want to be eating such a healthy diet, to get as many nutrients as you can from your diet. And then if there's still something that's missing, that's when you want to supplement it. So let's start with vitamin A. This is not beta carotene. Beta carotene is found in stuff like carrots and plants. That is actually called provitamin A, because your body can convert it into vitamin A, but at a 12-to-1 or an 8% conversion rate. So you need 12 beta carotene to make one vitamin A, basically. So ideally, you're getting this from animal foods, fish, eggs, dairy, and the fat from those animal foods is where the vitamin A is stored because it's fat soluble. Vitamin A is going to help keep your skin healthy. It's going to help heal the skin and the mucosal lining. So throughout your mouth, through the gut, stuff like that. It's going to regulate your mast cells and improve, so less allergies. Mast cells are one of the big cells that release a lot of histamine. So that's going to reduce allergies. It's going to improve differentiation of your immune cells. So your body will be able to better make the cell that it needs to fight off whatever it's reacting to. Fun fact, vitamin A has been used since 1932 as a treatment for measles. They would use 100,000 IU to 200,000 IU for babies. So it is possible to go toxic in vitamin A, but it's very difficult. So be careful, like if you're taking a vitamin A supplement for a long term, especially at a high dose, and you start feeling the different like headaches, you should feel it before it becomes an issue. You're going to get headaches or neurologic symptoms or nausea. You're going to feel pretty crummy. So keep that in mind if you're taking a high dose of vitamin A for a long time. But in a short period of time, a high dose of vitamin A is going to do wonders to deal with different viruses and bacteria. Vitamin D, like I talked about, vitamin D has a receptor on almost every single immune cell that there is. And all of this is in relation to the immune system. Of course, all of these supplements, all of these nutrients do a lot of other functions in the body, but this is as it relates to your immune system. So vitamin D is going to enhance your body's ability to fight off pathogens. So any virus, fungus, bacteria. It's going to improve your Treg cells so that way nothing gets overreactive. It typically will improve your Th1 function and lower the Th2. So again, helping with allergy symptoms. And it's free. You get it from the sun until November. But you can get it from the sun, you can get it from animal foods, and it works wonders when someone needs it. Zinc is something that you see so commonly because it helps with over like 300 different processes in the body. Specifically for the immune system, it's going to lower your allergy and autoimmune responses. It can help to improve the speed and efficiency of your immune system. So your immune cells can get to the infected area, to the damaged area faster and take care of it faster. It's found in oysters if you like those. Eggs, beef, and dairy are also great sources of zinc. Vitamin C, not ascorbic acid on its own. So you want a whole complex vitamin C. We use from standard process Cataplex C. We use Camu Camu, acerola cherries are great. And then you can get it from, of course, the citrus fruits. Kiwi is actually, I think, higher in vitamin C than oranges are, by the way. So vitamin C is helping a lot with your connective tissues, so skin health, hair health, nails, but it also helps your white blood cells find where they need to go faster. They're kind of the airport director guy telling the white blood cells go that way, deal with the infection over there. Vitamin C is also a great natural antihistamine. So if you've got allergies, try that before you reach for Allegra next time. So then what do you do when you do get sick? So what we've seen the most, especially for viruses, astragalus, elderberry, olive leaf have been the three most common that we've used for a while now. Try one. If you don't feel any different in a few days, 3-4 days, move on to the other one. Move on to elderberry. Try olive leaf. I would say that's probably the order that we see them most commonly. And then if someone's got a sore throat, if you've got a sore throat, standard process does make a throat spray for that. I know elderberry is something that can sometimes help with that as well. If you gargle the elderberry or whichever herb you're trying, try gargling it too. See if that helps soothe the sore throat. That could be a good sign that it is the one that's going to help you. So then we will also use thymus PMG or spleen PMG. Those are thymus and spleen are the two big immune organs that your body's going to use in response to infections and allergies. Start with thymus because thymus tends to be the organ that's involved more often than spleen when it comes to an infection. If you don't notice a difference, swap over to spleen in like 3 or 4 days. The best way to explain how these work is they're similar to homeopathics. So they're going to help push the nutrients, push what that organ needs towards that organ, and it helps to direct stress away from the organ. So it's actually, you can't overdose on these because they don't have any active like stimulatory component to the immune system or to the body. However, Thymex is a different one. That one does have a stimulatory effect to the immune system. So you don't want to take that one unless someone has tested you for it or unless you're very sure that you need it. I would ideally have someone test you on that because that can create or worsen a cytokine storm if you don't need it. So you want to be careful with that one. And then, of course, while you're sick, you're going to increase the dose of vitamin A, D, or A, D, C, zinc, or zinc. You can up to even double what you are taking as like a maintenance dose. So those are all on the sheets that I put in the chat. I can post that again if anyone needs me to. And then after you've been infected, after 3 or 4 days after your symptoms have started, that's when to deal with the cytokines to help your body clear those cytokines faster so you feel better quicker, you want to use glycine. A very high dose of it. Glycine is an amino acid, but it actually tastes sweet. So you're going to want to, you can open up that capsule, taste the glycine. That actually will, having your body taste it has a better effect because then your body knows that the glycine is coming in. It allows your body to absorb the glycine a little bit better. So this is helping deal with the cytokines in the liver, helping your liver break these down. So that way, if you're getting like night sweats afterwards, if you've still got a residual cough, any residual symptoms from the flu, from the cold that you had, that glycine should help take care of it. And once those are gone, then you can stop taking it. Quercetin is another great antioxidant. It's another one to help slow down the production of those cytokines. And it works really well as an antihistamine. It helps to stop the mast cells from breaking down. All right. that's about all I have planned to talk about. If you want more information on me, there's my website. If you want to ask me any questions afterwards or talk to me in private, you can send me an email. Or if you found this useful and you want to be a patient, give the office a call, talk to Chrissy. She's great, and we'll set up an appointment with you. But does anyone have any questions now? Anybody?
I have a quick question.
Yes.
The PMG that you
Yes.
signed this PMG, what does the PMG stand for?
What that is protein morphogen.
Oh, okay, that helped.
Yeah.
Never mind. And one other quick question about have some sugar. When you talked about be careful with the no sugar.
Yes. So
What is the sum?
So the sum, usually it's more so the added sugars. Typically it's, if you're drinking soda a lot, or if you're eating a lot of those different processed foods that have a lot of added sugars, typically we tend to overeat that kind of food. Where if you're eating, a piece of fruit or two, or if you're having some rice or starches, the more whole food type carbs, sugars, we tend not to overeat those as much. It's a little bit harder too.
Gotcha. Okay.
So, I mean, yeah, like even if you are making sweets with natural sugars, that's something that you kind of want to be careful with if you're suspecting if and one thing we will do with some patients that we think are having that have too much sugar is we'll have them go 2 weeks zero sugar at all, monitor every symptom that you have, even the nitpicky stuff like, oh, my knee hurts once a week, twice a week, like every symptom you can, and how much of that improves over the course of 2 weeks with zero sugar.
Thank
you. So you can have bouts where you do zero sugar, but if you go long term without it, that's when some issues tend to start popping up. 6 weeks seems to be the sweet spot where it starts to become a negative on those extreme diets. Does that help?
Absolutely.
All right.
Oh, I see chat questions.
Oh, are there? I can repost that for you, Jay. I'll do that now. So that'll have the doses that we kind of recommend we give to have patients do. The especially nutritional recommendations. That's the one with what we do for the immune system most of the time. Casey, so to prevent it, I mean, kind of like the lifestyle stuff that we've been talking about, but yeah, you could increase or start taking some of the vitamin A, the vitamin D, the zinc that we were talking about. And hopefully, like if you're doing all this stuff consistently, it's one of those things where we're working on your body's resiliency as well. You may still get sick for a few days, but the goal is that you kind of bounce back from it very quickly, and hopefully it doesn't your symptoms aren't as severe as they would be. Hopefully that makes sense.